Thank you, Mr. Chairman. Admiral Red, good to see you, sir. Thank you for your service. My wife is a retired Rear Admiral in the Public Health Service, so I know your core, your work, and what you're dedicated to. So if you could, perhaps discreetly, just describe to us what it means when the president starts to call the coronavirus a hoax, or puts out information which is medically inaccurate. What, from your perspective, is necessary in order for you to be able to do your job and for the public to be able to respond to the message which you're sending, which is medically accurate in terms of the disease itself, and then what the response should be from the public?
I think that in the last several weeks, there's been a focus on making sure that we are in alignment as a whole of government approach. I think that that's been very helpful with Vice President Pence in charge. I think that will help make sure that when a decision needs to be made, that there will be communication across departments so that all the experts are able to work more closely together. And I think that's going to be very helpful as we move forward here.
Okay, well, thank you, but just know that we respect you, and we respect science, we respect your conclusions, and we really don't want this to be politicized at all. That will interfere with our ability to implement a plan that is effective as soon as possible. I think we've already seen too much delay in not responding correctly and doing so soon. I'd like to come to you, Mr. Zabat. And that's on the question of airline fees. We have a pandemic which is going to hit the United States in much larger measure over the next weeks and months, according to the experts. We have airlines that actually have taken charge fees, change fees, and they made a whole industry out of it in terms of the amount of money which they can, in fact, charge. The DOT is the only consumer protection agency overseeing air travel, and you are statutorily charged to stop unfair practices in aviation, allowing any airline to charge these excessive fees during the coronavirus outbreak is beyond unfair. So I urge the Department of Transportation to take action immediately and prohibit all cancellation and charge fees during this emergency. Anything less is a failure to fulfill your duty, and that's why I plan to send a letter to Secretary Chow later this afternoon, formally asking her to suspend these change and cancellation fees in the face of this public health crisis. The time for DOT to act is now. We don't want citizens deciding they have to fly, just because the cancellation fee would be too large if, in fact, from their perspective, given their own health, their other family members' health, that it might be a danger to them if they came into contact. Would you commit to ensuring that the DOT, which is the Consumer Protection Agency, ensures that change and cancellation fees are suspended during this crisis?
Your concern and your request is noted, Senator, and you have my commitment that we will get on that right away. As you say, this is an emergency response situation. We're not looking to spend months or years developing a rule, so we'll get you an answer back very quickly.
Yeah, I think that's not an incidental issue for many families. I can see more and more people have flown like 7 times in the last 10 days. More and more people on each flight have a mask on. So for every one of those people, there's somebody else that's very concerned and didn't want to cancel the flight because they had to travel, but they might have if they didn't have the additional fee.
You're not the only one who's noticed that. I've noticed that several of the carriers in the industry have already decided to say that that they're going to be canceled, that they will withdraw some of those fees.
Yeah, well, I just recommend to you that it become an industry-wide practice through your insistence upon it. I think it'll be great. And if I may, Admiral, the highest fatalities from the coronavirus have been in areas where the healthcare system has been overwhelmed. CDC must take steps to prepare hospitals for surges of coronavirus cases that could stress healthcare systems' capacity to care for those patients, especially those who may need hospitalization and airborne infection isolation rooms. CDC's current guidance, which hasn't been updated since February 11th, nearly a month ago, is for facilities lacking airborne infection isolation rooms to transfer patients to facilities with available rooms. But we know this option may not be available if there is a surge of cases in a particular region. Dr. Red, can you commit to provide hospitals and other healthcare providers clear and specific guidance on how to safely care for a surge of patients without airborne infection isolation rooms?
Let me look into that and get back with you. I think that you're bringing up a very important point, and that if there are, the number of patients exceeds the number of beds, there's going to have to be guidance for that situation.
Yeah, so you will provide clear guidance to those hospitals?
Yes,
that
sir.
what you're saying?
Let me get back to you with that, but yes, we will do that.
Yeah, I think you will get back to me, or you
Yes.
will provide the guidance?
First get back to you, and then provide the guidance.
I think they need guidance. I think that many
sir.
places in this country need it right now. They need to know what to do. So I would honestly, I'd put a crash team together, try to figure it out tonight, put them in a room and send it out to these hospitals. They're out there waiting for you, you're the expert, to tell them what their plan should be. So I honestly believe that it could hit a region within the next couple of days and they'd be without any real instruction. And I think that would be providing a disservice to those people. So thank you, Mr. Chairman.